You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Good evening, ladies and gentlemen, and fellow healthcare enthusiasts. I welcome you to this episode of the DOCtalk Show, proudly brought to you by Quizmali Productions and sponsored by the Ministry of Health of Uganda and its partners. I am Dr. Muyanga Andrew Mark, your host tonight on the journey into the world of medicine, and certainly your host in the discussion we are having, 90 days without aid. What has been the impact of this on healthcare services, most notably HIV services in Uganda? And in-house to do this discussion justice is a lady right next to me and a gentleman on my far left who I will request to introduce themselves to the audience. Let us start with the lady. Ladies first.
Good evening, Uganda. I'm glad to be here. Thank you, UBC, for hosting us. I am Flavia Kyomukama. I am the team leader at the National Forum of People Living with HIV Networks in Uganda. And this is an umbrella network for all those networks, support groups, and organizations of people living with HIV. And we span across the entire country, in all the districts and in all the cities. So anyway, wherever there is a person living with HIV, we are. And we are glad to be here and to discuss this current state of affairs, especially when there is a freeze on our ARVs and our services for the next 90 days. Thank you.
Thank you so much, Flavia, and certainly we thank you for your service to this country. And next we shall get greetings from the gentleman on the far left.
Good evening, listeners. Dr. Byamukama. I work with the Uganda AIDS Commission as the head of HIV prevention. The Uganda AIDS Commission is the government agency under the Office of the President, which is responsible for providing leadership to the overall national HIV response. I'm pleased to be here.
Thank you. It's a pleasure having you around, and we certainly hold the confidence that you will do the discussion justice and you leave our fellow countrymen better informed. So, on the 20th of this month, the US swore in its 47th president. That is His Excellency Donald Trump. And following that, he issued a number of executive orders, among which was the freezing of foreign funding. And it has had a number of widespread implications. But the discussion of this evening is about the impact of the decision that was made on HIV service delivery in the Ugandan context. Flavia, would you mind enlightening us, first of all, on what decision the president actually made and what is on ground currently within the country in relation to it?
Thank you, Doctor, for allowing me to share, to give a brief background. So over the last about 37 years, or even I say 42 years of the HIV epidemic, the American government has been supporting us with research, with the community support, has supported the government or the Ministry of Health, the AIDS Commission with governance and leadership. It has supported various areas, but the magical one was that which came into around 2001 to 2003, when the PEPFAR was launched in this country, and the government of the US government agreed to provide antiretroviral treatment and related commodities to the world. And Uganda was part of that because we have always been a leader, and therefore Uganda was one of the first beneficiaries of the HIV funding for antiretroviral treatment. So fast forward, the 47th president came into office recently, and on the 21st of last month of January, we woke up to an executive order that was halting all HIV funding globally, especially that through PEPFAR. And so that meant that most of us who are on treatment came to a rude shock. we got frozen, but you know, we thought maybe it is just a joke, because we didn't think that any country with diplomatic relations with any other country would actually wake up to one day and say, I'm rescinding, or I'm putting a suspension on what has been going on for the last over 30 years. So after that executive order, which we got on 21st of January, we started working, and we knew that for the resources which were already allotted and committed, we would continue doing until the review of the HIV funding is done, because any audit that happens does not stop a country or an organization from working. It allows for people to continue working, but the audit takes place. So in this case, on the 24th, another stop work order was released by the US government, and was saying put down tools around HIV services.
So I am requesting that probably we break down this stop work order for people. If you are talking of a stop work order, Dr. Byamukama, are we talking about a clinician in an art clinic not working, or are we talking about a clinical coordinator within an HIV-related program not working? How widespread is this stop work order?
Thank you. I think what is concerning is that this is a still evolving scenario. The President of the United States first put a sweeping order that would stop everything, but they later reviewed and said life-saving support would continue. That includes life-saving treatment. So, but we are aware that there is so much work that goes around support the giving out of the pill.
Yes.
So it appears like in the current state of events, that support is not catered for. The giving out of the pill is just but one part of the process, or the pill itself is but one part of the process. So it looks like the waiver does not take care of the important support staff that go to make sure that this pill is effectively delivered. So this order is still of concern to government, but as I said, it is still an evolving scenario. We're still waiting to see where they firm their feet and say, this is it. And we have been preparing for a long time. I must emphasize as government that such a day will one day come. So as we have our conversation, we shall try to allay the anxiety of our brothers and sisters who are already living with HIV. The government has been anticipating that one day, because even I think when President Trump was the president in the previous 4 years, he threatened. And on several occasions, government has rehearsed what we would need to do in case such a thing happened. But right now where we are, we're still hopeful that he will not withdraw all the support. This is life-saving. It would cause a catastrophe. And I think as we go along, we shall unpack the possible consequences, negative consequences, if such an order was to be implemented in the way it was initially thought about. But we are hopeful that the US government will come to understand President Trump, to know that there are implications beyond Uganda that will have repercussions on the US government itself and the US operations. And I'm very sure he will consider. But even if he doesn't, the government has rehearsed the situation, has seen it coming, so the government should be able to manage.
It is certainly comforting to know that we have a backup generator, if I may put it that way, because it's clear that electricity, in quotes, was cut off at some point. I have personally interacted with colleagues who told me that they're out of work. They've been working within different NGOs related to HIV service delivery, and they're out of work. But allow us to have a short commercial break, and we shall be right back to continue with this discussion.
This message is from the Ministry of Health with support from partners.
Since 2015, Quiz Mali Production has been at the forefront of media innovation. Our passion for storytelling and creativity has driven us to deliver over 100 successful projects, making a lasting impact on the industry. With 4 highly acclaimed TV shows, we've become a household name, bringing quality content to your screens. At Quiz Mali Production, we specialize in content creation, digital media marketing, media buying, and documentaries. We plan corporate events, provide top-notch photography and videography services, and offer seamless translations and live streams for your every need. Join the hundreds of satisfied clients who trust us to bring their visions to life. Quiz Mali Production, your partner in media excellence. Visit us at Quiz Mali and let's create something amazing together.
Looking for instant excitement? The Uganda National Lottery Spin for Cash game is now available online. Wherever you are, you can join the excitement for just 500, 1,000 and 2,000 Uganda shillings. Don't miss out. Register now on www.nationallottery.go.ug for a chance to win your share of 2 billion instantly. What are you waiting for? Play Spin for Cash now, anytime, anywhere. Ituba is the proud operator of the Uganda National Lottery.
Uganda National Lottery. Dream, play, win.
Participants must be 18 years or older. Play responsibly. The Uganda National Lottery is operated by Ituba Uganda and regulated by the National Lotteries and Gaming Regulatory Board.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short commercial break. This is the DOCtalk Show, and the topic of discussion this evening is the effect of the suspension of foreign aid by the U.S. government on HIV service delivery within this country. To engage or to participate in the discussion, please reach out to us via the number displayed on the screen. You can also reach out to us via our Twitter handle, which is shown on the screen. We left off on a point where we had acknowledged that actually several health workers are sitting at home and not serving or not doing what they studied to do because of an order that is going to last about 90 days. But the days, thank God, have reduced. I hear, and let me emphasize this, I hear that this freeze involved even HIV drugs as well, antiretroviral therapy drugs. And there is a tweet I saw from Winnie Byamukama. She's one of the leaders of UNAIDS, I think, where she was thanking the U.S. government for having lifted the freeze on drugs, that the drugs can be given out. But then the question arises of what is the essence of lifting a freeze on drugs, but when the workers themselves are uncertain on their future? Would you mind helping us to understand better what is happening behind doors?
Thank you very much, Doctor, for that question. Before I go into the ART discussion and where us as people with HIV, our families, those who are vulnerable, those who are already marginalized are now, I would like to re-emphasize and re-echo that PEPFAR currently invests in 68 pharmacists, 756 laboratory staff, 1,622 nurses and midwives, and 923 doctors and clinical officers. So we want to thank the government, the US government, for waiving the ban on food, on ARVs and other commodities. But we also would like to say that it is not complete, or this ban is incomplete unless it comes with accessories. And so the accessories are the health workers. And so, why I elaborated on all those health providers, I did not talk about the about 60,000 community health workers who have been volunteers, expert patients, mentor mothers, mentor fathers, you know, all those community peers that have been supporting people to get treatment and stay adherent. We do know that, of course, of those who are HIV positive, 97% have tested, they know. And of those who know and are on treatment, 92% have been viral suppressed. So they have minimal chances of spreading. But we also know that it is mainly the US government which even gives pre-exposure prophylaxis for those in high-risk areas, for those communities that are not able to quickly protect themselves, but who can rely on prevention to ensure there is no more infection. So that said, we know that when people are immune suppressed, their chances of spreading are minimal, and that means positive prevention. Yes. So to come to last week's difficulty and shocker, the ARVs are seated in the facilities, but the ambulances and the vehicles don't have drivers to deliver them to where they are supposed to take them. And recently we have even, I think, adopted the differentiated service delivery model, where the ambulance drops at a center and people pick. So easing people's movement and also the cost of reaching the facility. But we also know these drivers cannot take medication that is not given, it's not dispensed, because there is a suspension. Maybe it's not a termination of work, but there is suspension of work for 90 days. That is about 3 months. So many organizations, health facilities, clinics have suspended staff because they don't have internally generated money to give the staff to remain for 90 days. So a number of health facilities, IDI, MJAP, AIC, they have actually called people to pick treatment as soon as this week. Others are even ending next week because they don't know what the future holds. So there is still a little bit of skeletal staff now, people volunteering. Let's be here, provide for those who are available. We have organizations like TASO and MALDME who are saying, for us, we started as volunteers and we want to applaud you, that they will continue working. The clinics will be open. But also that means limited staff to too many numbers of people with HIV.
Dr. Dan.
Yes.
The picture that Flavia has drawn for us is generally not a good one. And it raises the question of how reliant are Uganda's HIV care services on foreign aid?
Yeah, that's a good question. And the Uganda HIV response is significantly reliant on foreign aid and majorly the US government. So the US government is the biggest supporter of Uganda's HIV response in terms of everyday consumables, everyday things which are needed every day, not infrastructure, that kind of thing. So if they were to withdraw all their support, it would not come without pain. It would come with some pain. We have seen it in the past, even locally. US government, PEPFAR, has withdrawn from certain districts. They wake up at the new planning year, they say, districts A, B, C, D, you no longer receive the PEPFAR support we've been giving you. So it causes stress, it causes anxiety, it causes confusion, but those districts have managed to recover and stabilize and find within their means ways of keeping their citizens on treatment. So in case these 90 days are over, and indeed Trump is stuck to withdrawing and freezing this aid, yes, there will be pain. yes, there will be some pain. But I don't doubt our ability our resilience, because as the Uganda AIDS Commission, we have been working on a sustainability plan. We saw this coming. So the Uganda AIDS Commission, working under the guidance of our Minister for the Presidency, we have been working on a sustainability plan. But what is painful is that our sustainability plan, when we consider all the permutations, it looks like for the long term, we shall still need donor support. When we look at all the possibility, all the savings we can make, all the innovations that can earn us some more money, we discover we still need donor support. But fortunately, we still have some donors on the ground. Global Fund is still on the ground, and other philanthropists on the ground. So we believe the Uganda government should be able, within these 90 days, to come up with a plan to make sure our people who are already living with HIV do not feel the pain. And it's a commitment. The president has said this before. Even when they threatened, he has assured the population that whether they go, you remember when he signed the anti-homosexuality bill,
yes,
there was a threat that they would withdraw. So don't think by the time he signed the anti-homosexuality bill, he had not weighed the possible consequences.
yeah,
And he had reassured all our brothers and sisters living with HIV that the government will make sure, will take care of you if they go. So I am sure within these 90 days, good enough, we have enough stock of drugs for those 90 days. Those drugs are ours.
yeah.
Even if they bought them with the money there in our stores, they're ours, we shall give them out. They are ours, and if within those 90 days, the government discovers that actually Trump is taking away all or part of, I am very sure, according to the promise of the president, we shall re-strategize and make sure there is no Ugandan who is, because the consequences can be terrible.
Yes.
The reversals can be severe. We have made great gains. I usually talk to young people. Young people have not seen a person living with AIDS.
True.
For us who were there in the 90s, we saw. We would not want them to see. And I'm very sure the government will make sure that doesn't happen again. And it has been spoken about from even the highest office.
Thank you so much. So we hold the hope that at the end of the 90 days, there will be probably they'll unfreeze funds, if I may put it that way, and programs will continue running as usual. I like being optimistic, but the question we shall start with, and Flavia, I'll throw this to you, is in the event that President Trump actually decides to completely withdraw this aid, what do you think would be the long-term effects on HIV service delivery programs generally within this country? Allow us to have a short commercial break, and we shall be right back to continue this discussion. Thank you.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Coming soon on UBC.
Are you ready to take your fitness journey to the next level? Join the Sweat Squad by Sion. Coming soon to UBC TV. With expert guidance, cutting-edge workouts, and a supported community. You'll be unstoppable.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short commercial break. To participate in the discussion this evening, please reach out via the phone number displayed on the screen or even via our Twitter handle. And by the way, I'm reminding you that we are streaming live on YouTube. We left off on a point where I had created a scenario that we hold the faith and belief that when the 90 days are done, actually funds will be released, because if you interfere with the HIV service delivery in Uganda, I believe you're interfering with HIV service delivery world over. We are having tourists coming from Britain, coming from the US, from Australia, from Sweden to get services here. But along the way, in case HIV is highly prevalent in Uganda, guess what can happen? You can pick up HIV. So I don't believe, to be honest, that the US government can take such a drastic step. But in the event that the freeze continued past the 90 days, what do you think would be the long-term repercussions of such an action? Flavia.
Thank you. Thank you, Doctor, for asking me that long-term. For me, as a person living with HIV, I don't even want to know about after the 90 days. My interest is now. So if there was a flood in this country and hit Kampala, what would happen? So for me, that is the kind of situation I'm looking at. And for me, it is surviving today. It's not even about tomorrow. So I would like to see now the government of Uganda, the Ministry of Health, and the Uganda AIDS Commission here represented by Daniel. I want to see the Office of the Prime Minister. I would like to see the Speaker of Parliament putting in place an emergency catch-up plan. We don't have ARVs being delivered. Yes, there is a waiver on delivery. So what is the government doing? What are you doing, our Honorable Anita Among, our Speaker, to ensure that we have resources going to these clinics and hospitals and to pay the community health workers who have been delivering these medications so that we don't have a break? Because if there is a break, we had successfully reduced mother-to-child transmission to 5,000 every year. So this simple break of 90 days is going to spiral, and we shall find that at the end of the 90 days, if we want to do an assessment at the end of the year, you find that we have maybe double or triple new infections because people can't reach medication. And this is not about us who are working. The mothers who are being tested today won't even be tested because there is no clinician to test them. How are they going to know they are HIV positive? And how are they going to be initiated on treatment? So for us as people with HIV and our families, we don't want to hear what will happen in 90 days. We want to hear what is happening now. Where is that task force the president initiated in COVID? Can it be started now? And all the districts looking at their facilities. Yesterday, CDC also, we had, there is a stop work order. And CDC has been supporting government facilities. So if you have not panicked because NGOs and clinics have closed, the workers have stopped, please panic, because even now your buffer, your cushion is under threat. So instead of discussing the shoes of the parliamentarians for next financial year, can we have a supplementary that fills the gap right now? Every member of parliament has a district forum of people living with HIV. Engage that forum. Let us go to the sub-county forums of people with HIV. Let us follow up the support groups and the people at the health facilities. Are they getting treatment? We need to do something now. We can't wait for 90 days because we don't have life for 90 days if we don't have treatment. It means we are going to have a backlash on the gains we have got over the years. We have endeavored to take medication. For me, I'm now 22 years on treatment, and I am immune suppressed. It means like I'm potentially non-infectious. But if I don't get the adequate treatment, I can get because I'm able to reach and call and get. But there are many who won't be able to reach. Therefore, their suppression is going to be reversed. They are having sex, they are delivering babies, and who knows, in the next 30 days, what is going to happen? Where people are not testing, where mothers in ANC are not being referred for ART, where that baby who needs nevirapine can't get it. We need a catch-up plan, an emergency action. Bring us on table, we work together like we did in COVID. Because this is unprecedented, because even for COVID, we had 2 weeks. Preparation, we were told in 2 weeks we are shutting down. And so we prepared. This one came as a shocker. Same day, I had a write-up to say, shut everything, no more, no cent can be released. So how do we work as people with HIV? As mental mothers, as those social workers who have been in the antenatal clinic to provide catch-up and referral and birthday support, how do we sustain this in these 90 days? Don't ask me about after 90 days. Tell me what is on the table for the 90 days. Can we meet with Global Fund? Can we meet European Union? Can we meet AIDS development partners to see what we can reprogram? And even before going there, Parliament is releasing billions in supplementaries. Where is the supplementary for ARV delivery for this period? I would imagine that this whole week that was passed and this coming one, we are discussing how to dispatch money, quickly release money for the districts and the district people with HIV, the maternal health, the gender committees, to see that there is medicine for HIV, for antenatal, going. Because it's not about ARVs alone. It's about maternal health. It's about childhood illnesses. It's about cancer. You know, the US is putting in for cervical cancer screening and also for the treatment. Can we, for this week, next week, and this very week we are discussing, last week we didn't see enough action. Can we see action that puts in place an emergency plan to make sure we continue and sustain the treatment services that have been delivered for the last 22 years of art in this country and the related services?
Wow. Flavia, I hear you well. And it is my hope that the parliamentarians out there also hear the message Flavia has communicated. She's not thinking long term. No. For her, it is an issue of life or death. And there are people who will not wait for, we are remaining with about 79, is it 78 days for this to get done? There are people who cannot wait that long. I am very sure that each and every person watching me right now has either a family member or a friend with HIV who is getting treatment. Kindly, in the spirit of standing with these friends, brothers, sisters, mothers and fathers of ours, reach out to your parliamentary representative, your MP, and inform him that these discussions needs to be on the order paper this week, instead of discussing about shoes and dress codes in Parliament. Allow me to continue, Mr. Daniel. We have heard a lot from Flavia.
Yeah.
Ultimately, we need to think of what to do. We can't continue lamenting all the time. So what steps do you think government and other stakeholders can take to fill this gap that has been created?
Thank you. I think I want to first emphasize the risk before us, the risk of losing the gains we have made as a country in the HIV response. If we talk about treatment, there is a whole process that is mainly supported by PEPFAR. So many innovations supported by the US government to make sure our people get treatment. People are riding motorcycles to take treatment to islands or to distant places. Yes. People are taking HIV test kits at midnight to get a chance of reaching the sex workers who have the highest HIV prevalence. There is so much work being done to make the treatment program work.
Deliver blood.
Yes, so there's so much being done beyond. There's so many challenges that our people face in accessing the services in the health facilities, in the stores. So there's so many innovations which really the government of Uganda would not naturally afford, that are being implemented, funded by donor money, to make sure our program works very well. So there will be a reversal. If this aid is withdrawn, a reversal will be seen in an increased number of people who are infected with HIV, starting with children. There's so many mothers who are having challenges to come for the PMTCT program for the mother. We track them. We move to their phones, to their homes, take border. Those such initiatives to support mothers, adhere to treatment, they will die out completely. And we shall see an immediate increase in the number of new HIV infection. We shall inevitably see an increase in the number of AIDS-related deaths. Because beyond giving the treatment, there are so many people who are facing challenges in adhering to that treatment. So with support from partners, we are implementing programs beyond the national, the standard health sector initiatives. We go an extra mile to track those who did not turn up when they were supposed to turn up yesterday. Follow them up in their homes, into their beds, offer them counseling. All those services do not fit within our standard health system structure of functioning. So those innovations are mainly funded by our donors and mainly PEPFAR. So if such initiatives, we lose them, we shall see more of our people not standing up on the expected date for their ARVs. Nobody will find the resources to follow them up, and we shall see an increased death. We have seen young people, they have never seen a person with AIDS. I think finally they will see. So they are real threats. And that's why I really feel my sister Flavia here. Our leaders need to take this seriously, because the reverse, we cannot go back to the 90s. That said, we have responsibilities. Number one, as individuals and as Ugandans, yes, to make sure the situation we saw in the 90s does not happen again. There is a common proverb they use in Uganda that so as much as there is a freeze, there is an uncertainty in these 90 days. But most of the staff who are being supported by PEPFAR grants are Ugandans. I do not expect that they will just walk away from our health facilities. You have worked where you have waited for salary and it was not there, but you do not go home to sleep. So we would expect some patriotism to come in for the sake of the common good. We shall stay. We're hopeful. As government strategizes on putting the pieces together, I think maybe if you're sent away, but if you're in charge of a health center, you are the only doctor in Uhganda, you are supported by PEPFAR, and now PEPFAR says we are in a state of reassessment. I don't expect that doctor to go away, because they know. This is an appeal. It's an appeal as an individual. But eventually, for us to end AIDS as a public health threat, it will go to individual efforts. As a doctor, you have paid the patients who could not pay their own bills in the hospital. You have gone an extra mile. Doctors have done that.
Daniel, I actually have a lot to say on that.
So, I am calling upon the patriotism of individuals. The individuals must come out. And we pray about this is a threat to everybody, not just people living with HIV. I want to emphasize one other thing.
Daniel.
Yes.
Allow me to cut you short. Yeah. You said you would like to emphasize, and certainly we shall start with that in the next segment of this presentation. So allow us to have a short commercial break, and we shall be right back.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
We get to cruise on the mighty, spectacular River Nile after the falls.
Mostly when we come for a boat cruise,
yes,
we expect to see.
Is from the Ministry of Health with support from partners.
Welcome back from that short commercial break. This is the DOCtalk Show. To join the discussion this evening, please reach out via the number displayed on the screen or via the Twitter handle. We left off on a point where Daniel was telling us about the potential stopgaps that government and stakeholders have to address this problem. And In the break we had, actually, Flavia raised the point that if you are going to the garden and your child falls sick, you certainly do not continue to go and dig. You have to put aside everything and attend to the child. And so this is an emergency. And we are not thinking long-term currently. So what does government currently have? And the stakeholders certainly to help us address the current emergency, because it's an emergency, actually.
I think it's difficult to address what government has to do. Government works with the people. So we each have responsibility. So before we closed, I had started articulating the responsibility of individuals. Eventually, most of the work has to be done by the individual. The government will look for the money. Like I said in the beginning, the president has always reassured our brothers and sisters living with HIV that if what we fear were to happen, he will make sure all of them are sustained treatment. And I don't doubt that he will do that. And as I said earlier, the situation we're in is still evolving. But to be sure that stakeholders, Minister of Health, Uganda AIDS Commission, we are convening now to start planning. It's very difficult to shoot a moving target. But we had been planning for this, as I said. We have developed a sustainability roadmap to see if what we fear will be the situation after 90 days were to happen, how would we sustain that? And very soon, this sustainability roadmap is almost ready. We shall fast track it, present it to cabinet, and show them what technical people think needs to be done to make sure we sustain the HIV response in the event. So what I think we shall do as a Uganda AIDS Commission is fast track this roadmap, have it before cabinet within a couple of less than a week or two. The cabinet passes it or makes recommendation, so that these 90 days we have approved this roadmap and we start approving the roadmap. But that said, there are responsibilities for individuals here. And specifically, as the head of prevention, I want to use this opportunity to talk to young people out there. Many young people they have not seen a person with AIDS. They have not seen the pain AIDS can cause. And they missed out the messages of long ago. And I have heard that many young people don't care with prevention. They believe if it happens, you will take treatment. But the situation and the anxiety we have as a country now should teach young people and everybody out there that prevention is still necessary. You can imagine we have around 1.4 million people who need HIV treatment. It's quite costly treatment. You can imagine if we are to ask that we shall cost share. So many people will be left behind. So many people will not afford the cost sharing. But that won't happen. But we cannot afford to put every Ugandan on treatment. So the threat of no treatment is real. The anxiety of having no treatment is real. We would want to emphasize that everybody there make every effort to embrace prevention. Because of easily available treatment, our brothers and sisters who have HIV look healthy and beautiful. Everybody thinks you can walk in casually. Even the risk you can avoid, you can casually take the risk because there's treatment. But the treatment is not guaranteed. So we want as an individual from today that we embrace prevention to make sure we don't get into a severe form of accident.
Young people out there of late have a saying of, if I die, I die. That if you see someone and you like them, they are to your taste, you go in and do whatever you want to do and you don't care about the repercussions. But the challenge with HIV is it's not like a car hitting you.
Yeah.
So it will not take you in one day.
Yeah.
It will take you slowly. So I believe we need to re-emphasize. I think this is the time to remind people about the ABCs once again. A standing for abstain. B for be faithful. C for
condoms.
If you can't, or if you don't understand what your partner is doing or anything of that kind, please use condoms as well.
I must also emphasize that the circumcision.
Yes.
We have discovered that among the new HIV infections we are seeing among men, the uncircumcised man is affected significantly. So let the men run for circumcision before things run out of hand.
So during the short commercial break we had, Flavia had a lot to say to our leaders out there. We discussed about the fact that the Ministry of Health budget, as per the Abuja Declaration, is supposed to be at a minimum of 15%, and it currently is at 7%. So those are discussions we need to be having in Parliament, and not discussions about shoes and dress code and the billions we are burning on that. Flavia also raised a number of other points. There is an issue of, you talked about cost sharing at one point, and it reminded me, Daniel, about the issue of a national health insurance scheme. Probably if we explore these avenues, we'll think of ways of raising income to support these various health programs and slowly get wind of donor support. But Flavia, please allow me to give you time to pass on your message to the people who are seeing you out there.
Okay. Thank you very much, Dr. and Daniel, for what you have said about government. I want to emphasize that no government in this world gives services on a silver platter. And that is the responsibility of governments across the world to provide social services and health for that matter. And therefore we demand that the government stands up to the occasion and does its work to deliver services to those who have been affected by this funding cut. And I also like to remind people that HIV will spread if the government is not going to be very fast at this moment. HIV does not come like Ebola, but we know that if we don't put in every day, 400 people are infected. So these are about 4 days since the cut happened. So how many are those? About 1,600 have already got infection because there is no prevention, effective prevention, maybe less because some still have some treatment, but there are those who have failed to access a condom because of this cut. I would also like to remind my fellow people in HIV, wherever you are, that we are coming to voting time. Every member of parliament in there wants your vote. They will come and appease you with a matchbox with a piece of soap. This is the moment to hold them accountable. Remind them that dead people do not vote, or sick people don't vote. So if they need your votes, it is now that they should show the cause on the floor of parliament to say our people are going to die or they are dying. Our mothers are dying in labor because the workers were suspended. Our babies are being infected because there is no nevirapine. It is the moment now that we start holding our members of parliament accountable. That if there is no ARVs, no reproductive service, there should be no vote for that MP who is there now. Let us watch each one by one, and we tell them we shall not vote unless we have a catch-up plan. And what does that mean? Because you appropriate resources as members of parliament. We want to see resources going now to the districts, people living with HIV, forum networks to follow this medicine and ensure that those who are non-suppressed, where we have been having direct observed treatment, continues so we have suppression, especially for our children and our young people. We are not going to watch as you share those many monies and you are saying we volunteer, we are responsible. No, we are tired of volunteering, and we have volunteered enough. We are tired of delivering babies who are HIV positive. We want to have some peace as mothers and fathers. We don't want to see more babies born with HIV. And on the budget, the Speaker, Honorable Speaker, we are asking, this is the moment when we are developing even the new budget. Can we have resources for health increased a significant amount that can meet the gap, but also the supplementaries? Can we have a supplementary of even only about 2 billion now to go to the district forums and the community health support systems to ensure that people access services? And finally, about the long term, the sustainability plan, just about the health. I want to emphasize and re-echo the 20-year health insurance scheme bill. It's the moment that Cabinet and Minister of Health, please bring it to the Parliament and we start discussing how to operationalize it. Countries picked from us, they have put it all across in the region. Uganda, we are still dilly-dallying. We are good at writing, but we never put policies in place.
Flavia, I think, has said it all. I would like to thank you so much, Daniel and Flavia, for sparing your precious time to come and enlighten us on what is happening. And before I leave, I would like to remind us that Ebola is out there. Please be careful. Take all the necessary measures you need to take. Wash your hands with soap and water or use a sanitizer. In case you see anyone with symptoms or signs that may make that person, or that may create the impression that that person has Ebola, please avoid physical contact with that person. And the other thing is we need to alert authorities in case anyone, even if it is us, has signs and symptoms which may be indicative of Ebola. Life has no spare. Let us be careful. Take care.
This message is from the Ministry of Health with support from partners.
UBC, inspiring Uganda.
One-on-one with Michael Jordan Lukomwa.
A weekly face-to-face conversation focusing on accountability, inspiration, information, and sensitization of the public from the various sources, such as inspirational profiles.
Having disability is not inability.
Professional guidance.
There is no special antiretroviral therapy that is given specifically for discordant couples.
And of course, politics.
Don't you see anywhere that you would give a credit in the fight against COVID?
My role as the owner of the country is not to, be preoccupied by giving credit to my servant.
We have said that if we are to talk to General Museveni, there must be certain conditions in place.
Is it true that you paid 5 million shillings to MPs that voted for Anita Monga and Tayebo?
That is laughable. Why would we pay when we have nominated them as SEC?
Every party has been represented in Uganda's parliament for 10 years. We only by one MP, you yourself, and my daughter, Susan.
Every Friday 9 p.m. it's One-on-One with Michael Jordan Lukomwa on UBC TV, inspiring Uganda. We get to cruise on the mighty, spectacular river.